So I will try to address today the answer to the question, what can I eat during breast cancer treatment? In my country, this question is quite often, and usually most patients get quite of a general response. But the scientists who study effective communication established that giving an answer to a question has to have 4 components. And they are be relevant, be concise, be specific, and then be gone. And the be gone part is quite important in the busy clinical practice we all have today. And the answer is usually you can eat anything, just try not to gain weight. This is the answer most patients get. And it's a relevant answer because obesity influences both efficacy and treatment side effects. It cannot be more concise. And really, it's quite, let's begin in a second. So the problem is this answer specific? And unlike other cancer, many breast cancer patients gain weight during treatment, although they are told not to eat too much and try to avoid obesity. But we have mucositis, which is the first thing that most people during neoadjuvant chemotherapy feel, and this can influence patients' ability to digest food. Then you have abdominal discomfort, you may have, let's say, bloating and constipation or diarrhea, and all this can influence your ability to just eat anything. Then you have nausea, then you have treatment-associated muscle loss, and this can influence your ability to keep your weight constant. Then you have fatigue, mental and physical fatigue, who maybe can influence your ability to do physical exercise. And then you also have, sorry about that, you also have disturbed sleep and stress-induced emotional eating. All these things can also happen in general population, but in breast cancer patients usually happen much more often. So please mind the gap between general nutrition and oncology nutrition. And let's try for like 10-15 minutes to think about the specific answer to the question, what can I eat during breast cancer treatment? And if we, to see the gap between general nutrition and oncology nutrition, and I will also show you later on a bit the gap between general oncology nutrition and breast cancer specific oncology nutrition. But for healthy people, what we have is the, let's say, the Harvard eating plate, who mainly to build up a plate of food, a healthy eating plate, you split it in 4. You have 1 part of healthy proteins, 1 part of fruits, 1 of vegetables, and 1 of grains. And you can use healthy oils and drink your water. Now, what is the difference when we are talking specifically about breast cancer patients is that to counteract the treatment-induced muscle loss and tendency to gain weight, and to counteract the metabolic modification that are associated with this type of cancer, we no longer split the plate in 4, we only split the plate in 3. And how do we do that? We just have half of the plate made of vegetables, and we combine together in only 1 portion of food both starches and fruits. And this small decrease in carbohydrate intake in my clinical practice is enough to counteract weight gain during breast cancer treatment. Of course, is not the only thing, but if you just have been diagnosed with breast cancer, please know that the fact this type of cancer and the treatment for it mainly associate muscle loss, and this can increase your tendency to gain weight. And to counteract this tendency, all I want you to do is to decrease a bit, just a bit, the amount of carbohydrate in your food. And I'm talking about bread, pasta, rice, potatoes, fruits, sweets also you can have some. But this should be only 1/4 of a plate. But since plates have all sorts of sizes, I use the hand as a portion size. And in my clinical practice, I ask my patient to build their plate to just follow and eat the main meals of the day, let's say breakfast, lunch, and dinner, with nothing in between but water. And each of these meals should be made half of the plate with vegetables, 1/4 made of high quality protein, and one of them made of carbs. And this is like the basis. Then we need to understand that oncology nutrition, unlike, let's say, nutrition for healthy patients, is based on a bit higher protein intake. And this is ESPEN guidelines. And of course, these are general guidelines for cancer patients. This has to be personalized for pancreatic cancer, for glioblastoma, and for breast cancer patients differently. But what I'm trying to underline is that we need to, during breast cancer treatment, we need to have a very close eye on our protein intake. And this can be a problem, at least in my country, I don't know in yours, but this can be a problem in some cases because many patients have heard of the book titled The China Study. And this maybe sometimes is the reason why some patients don't eat enough proteins. But I would like to make a long story very, very short and to state two things. The first thing is that this book is not a comparison between omnivore and vegetarian food. It's actually a comparison between vegetarian and vegan food. Colin Campbell is a biochemistry professor, a vegan one, and this book he wrote, it's a contradiction both of his own clinical research, as he published in 1976 and in 1983, two studies that show that in the case of insufficient protein intake, carcinogens are far more aggressive. So in this, the China study book, he contradicted his own research, but he also contradicted the database of the researchers that actually made the China study. And I will show that database in a second. What I'm trying to say is one simple thing. Although he devoted all his life to proving that veganism is the healthiest diet on the planet, he couldn't scientifically prove anything related to protein, and thus he kind of take a side trip to it and related, let's say, the protein story to cholesterol. And his conclusion was that total cholesterol between 90 and 170 is associated with increased risk of cancer mortality, and that even minimal consumption of food of animal origin increases the risk of cancer and cancer mortality, be them in a vegetarian diet. But I will recommend my patients to follow such an advice when I will see a healthy human with a total cholesterol below 90, which I'm still to be there. The database of the researchers that were quoted in this book were not vegan, and the comparison was not between vegans and all others. This is an epidemiological study that tried to understand the differences between the people and their eating and their diet and their health outcomes in 65 Chinese counties. And I would like to, I put here a picture from the region Tuoli, and I did that because the people in this region were shepherds, and they usually, let's say, ate like about 800 grams of dairy food per day. They mainly ate like maybe 100 grams of meat and then bread. rarely, look at the region, they rarely had, let's say, nuts or fruits or oils, healthy oils. There are no healthy oils in the mountains. And the database that you can see, but the book is like 400 euros, has this comparison between omnivores on the right, Tuoli and these all regions that I cannot read their names because they are in Chinese, are on the right, omnivores are on the right, and on the left are vegetarians. And I'm talking about people that were not consuming eggs or fish or meat. They were consuming dairy food and vegetable proteins like beans and kernels and seeds and so on. And when they compared the breast cancer incidence between omnivores and vegetarians, as you can see in this upper graph, here, there is mainly no scientifically different, statistically different difference that we can see. Also, when they compared mortality from all cancers, because this was not about breast cancer, this was an epidemiological study about all cancers, there was no statistical difference between omnivores and vegetarians. So I wanted to say that because many people think that this debate is about vegetarians and omnivores, but it's not. It's just a personal opinion of a vegan professor that even his own research contradicted his book. It's just a book. It is titled The China Study, is not the China Study. And we have data about the fact that eating unprocessed, lean, white, or red meat does not cause breast cancer. And this is not about going to extreme, eating only meat or eating high quantities of meat or eating deli meats or hamburgers. This is about moderation. There is no data that shows that eating moderately high quality meat, white or red, cause cancer or decreases the survival after having a cancer diagnosis. And another categories of patients think that they should go for let's say vegetable proteins, and they go for soy, and they think that the only two protein alternatives are either meat or soy. But when it comes to breast cancer, and the data we have about soy, we actually have quite a scientific chaos, and mainly because we either have inconclusive epidemiological data that show that soy intake associate a decreased mortality or does not influence mortality, or it influences only menopausal patients' mortality, or that it also influences HER2 breast cancer patients. And also we have preclinical data that shows that dietary supplements containing phytoestrogen, but mainly genistein, not all phytoestrogen, stimulate breast tumor growth, and that they associate tamoxifen and aromatase inhibitor resistance. But both of these are not data on humans, they are preclinical, and epidemiological data is not sure that we cannot eat anything, we just don't know. And I want you to understand that when I advise my patient, I want them to understand that I cannot say do something when my knowledge say it might be some problem there. So we have no oncologically safety data about the soy intake and about dietary supplements in estrogen receptor positive and HER2 positive breast cancer patients, but patients with triple negative tumors, they can eat soy if they want to. Also about meat, and soy, I was telling you that they are not the only sources of proteins, and we have data since 1952 showing that milk proteins have anti-carcinogenic effects, and that consuming milk and dairy foods during breast cancer treatment associates less weight gain, better immunity, less cardiac toxicity, and better metabolic profile. So this is very, very important, and why I want you to find your balance between between vegetable and animal food sources of proteins is because sometimes the patients see that they have mouth sores and they have bloating and they have diarrhea and they have also digestive symptoms. And what I want you to know that this little wound that hurts like hell and you can feel it in your mouth, it can be when all over the digestive tract. Mucositis does not only affect your oral mucosa, it can affect all your digestive tract. And if you have such little wounds on your digestive tracts, you better know, or it would be helpful to know that vegetable food sources of protein in such a case might be a bit harder to digest. Like a normal healthy person that has irritable bowel syndrome, let's say, that feels that if she eats an apple or a tomato, she will become pregnant in 5 months by bloating. When you are during chemotherapy and are feeling ill, please consider the actual food that help you both having a good and enough protein intake so you don't lose muscle, and also that you can digest. If you cannot digest beans because you are having mucositis, go for others. Try, let's say, I don't know, try some yogurt. If you choose not to eat meat, and you are having anemia, maybe you should know that some substances in whole grains, like it doesn't matter, phytates or oxalates, or some substances in green tea can diminish the absorption of iron. So eat your lentils, but do not also drink the green tea. Try to diminish the foods that might decrease iron absorption if you do not want to eat meat. And at least sometimes, if your anemia is quite bad, please also consider if eating fish or meat might also be an option in your personal case. Now, is oncology nutrition the same during each of the breast cancer treatments? Because as I said, we need to mind the gap between general nutrition and oncology nutrition, but also breast cancer specifically, oncology nutrition for breast cancer patients specifically is not the same during each of the breast cancer treatments. And although we still respect breakfast, lunch, and dinner, and also still split the plate in 3 and not in 4, we need during each of these treatment stages to have a bit of things that you as a patient can do to sustain your own treatment. You are not a passive recipient of treatment. Please help us to help you. So during chemotherapy, we need to avoid muscle loss. And this is very, very important because the active part of your muscle mass, the skeletal one, is the only part of the metabolic equation that we can increase or decrease, and this can directly influence your further weight gain. If you lose muscle, you can gain weight during neoadjuvant chemotherapy, and I'm talking neoadjuvant is the chemotherapy done before surgery. And starting just after the diagnosis, before the surgery starts, you can gain weight, and this can influence and increase the risk of side effects from surgery, from radiotherapy, and also from antiestrogenic treatment if you are estrogen receptor positive. So please try after the diagnosis, for the best of your abilities, to avoid muscle loss. And you do it in 2 ways. The first way is to try to have, as I said, the proper protein intake, be it from vegetable food sources, and I'm talking about beans, lentils, and so on, or from animal food sources. As long as you can digest it, try to have proteins at each meal. And the second way you can avoid muscle loss is by doing sport. It's extraordinarily important to do sport during chemotherapy. This will help you prevent weight gain, and this will also help you remain, how I tell my patient is fatigue during oncology-related fatigue does not go away with staying, with fainting on a couch. It's go away with sport. The harder was your day, the more sport you have to do. So please try to at least do power walks, to do yoga, to do Pilates, to do anything you can exactly, even in the day of the chemotherapy administration. Please try to do as much sport as you can. Also, please keep away from antioxidants that can, we have no safety data that show that antioxidants do not diminish the efficacy of chemotherapy. Also, do not drink alkaline water or go on juicing, because the main nutrients that we make fat inside the human body are carbohydrates if you eat them in excess, and especially fructose. So do not go overboard with eating fruits. You can eat fruits at each meal, but please be very, very careful with respecting the portion size, which again, I tell you, is the size of your hand or of your fist. That is, in short, what I want you to add to the general recommendation I explained in the beginning during chemotherapy. So please, please, please eat proteins at each meal, do your sport, and keep away from extreme diets. This is very important. Then, during surgery, I would like to be very, very mindful about emotional eating. And this please be one of the main things that I would like to stress related to surgery, besides lowering your vitamin K intake. And I wrote here some of the names because I hope you will know. Why do we want to lower vitamin K intake? Because it has, it can interfere with anticoagulant medication, and you can have more problems during the surgery time. So I ask my patients to eat less peas, kiwi, blueberries, plums, pumpkin, green leafy vegetables like spinach or lettuce, and green vegetables, and also from teas like chamomile or ginger or fenugreek. These, of course, I write them to my patients, and I ask them since surgery a few weeks to stay away from this food and try to focus their diet on something else. Then during radiotherapy, it's very important to keep your weight constant as possible, as it was when you done your pre-treatment CT, because that treatment, your radiotherapy, was done on your weight that you were having at that CT. So try not to gain weight. Also, if you start to have esophagitis and discomfort, try to avoid the food that amplify that discomfort. And also going further to the patients who have estrogen receptor positive tumor, mind your phytoestrogen intake. And I'm mainly referring to soy because, as I said, we have no safety data related to that, and to actively prevent osteoporosis, and not by taking vitamin D or calcium. You don't prevent osteoporosis that way. You prevent osteoporosis by doing sport and by eating berries and by not smoking and by trying to hydrate the best you can. Still, because oncology dietitians are quite few, and most breast cancer patients do not get access to oncology dietitian, 2 in 3 breast cancer patients gain weight during chemotherapy, and we go back to square one, which was what can I eat during breast cancer treatment? And it was, you can eat anything, but at least try to not gain weight. But if you gain weight, then try to eat less. And this in theory is very, very nice and logical, that if you eat less, then you will weigh less. Just that we are not actually in a pandemic of obesity because this works. It doesn't work for like 100 years, and it's not going to work during a treatment that increases weight gain. So in reality, when you eat less, what you actually get is muscle loss and water loss. You do not get fat loss when you eat less. To lose weight while eating less, you have to go below your basal metabolism. And when you do that, the fat tissue is quite protected because it is an endocrine tissue and it has a lot of hormones that protect it. Unlike the muscle is protected by no one. So what I want you to know when it comes to There are three things that I want you to focus if you are after diagnosis and try not to gain weight, or if you are during the treatment and you already gained some weight and try to, let's say, try to lose it. First of all, eat your main meals. Split your plate in three with carbs, with proteins, with high quality fats, and with enough vegetables to fill up half of your plate. At least try to consume nothing but water in between the meals, and during each stage of your treatment, try to focus a bit on sustaining the quality and the efficacy of your treatment. But beside this, what I would like to also add two things. The first one is that physical exercise does not cause lymphedema. In my practice, many patients are still afraid that if they are going to use dumbbells or do all sorts of, let's say, I have mothers that have breast cancer and also have little children at home, and they are afraid to hold in their arms the small children. There is no data, and we have very, very good scientific evidence that show that using your hands the same symmetrically with dumbbells, with swimming, with aerobic exercise, yoga, Pilates, and also with free weights, there is no increase in breast cancer secondary lymphedema. You will get a decreased risk. Doing physical exercise after breast surgery, including axillary surgery, is safe. Of course, not just after the surgery. You let your scars cure, and then 1-2 months after the surgery, you can restart to go back to your normal life. And also, this is not the only thing that matters. So it matters that you eat right and try to keep away from yo-yo dieting by going to extreme. I'm not going to eat, I'm not going to eat, I'm not going to eat, and then you eat a piece of your fridge. And then please do your sport as regularly and as intensely as possible. And then also please mind that insufficient sleep amplifies muscle loss, and this has a huge impact on increased hunger and also impulsivity, and it decreases the fat loss ability of any human. It can be your doctor. Any human that sleeps too little has this decreased ability to use fat as fuel. So if you are someone who needs to lose weight, then insufficient sleep might be a problem. So please mind that winter is coming. So please find a pleasant way to increase the quality of your sleep. And know this, that we cannot say that someone is fat or not by the way they look, unless they are really, really obese. When you lose weight by muscle loss, you can get increased adiposity during breast cancer patients, even in normal weight patients who manage not to overeat, if they do not do enough sport and if they have sleep disturbances. And in those patients that also either don't eat, either eat the fridge, either don't eat, either eat the fridge, then you will also see not only the increased adiposity, but also the weight gain. And this is very important. And why? Because we have something called leptin resistance. And what is leptin resistance? The adipose tissue is not just a tissue we just want to lose because we don't need it and it's ugly and so on. No, the adipose tissue is an endocrine tissue that secretes many substances. And when you have more fat inside your body because you try to lose weight by eating less, you will have more cravings and less satiety because some of these hormones secreted by the adiposity, by the adipose tissue, leptin, creates more cravings, and you will feel less satiety. Your eating behavior will become harder and harder to control, and you can get even more fat inside your body. And then we will all see it if you go yo-yo between I'm not eating enough and I'm eating everything and so on. So please try to find your balance and know that the similar words for unspecific are many, and I'm trying to underline the fact that breast cancer specific nutrition should be very specific to you, should be very specific to your immunohistochemistry. Is different if you have triple negative, then you have something. If you have estrogen receptor positive, then keep away from soy. Then always know that your treatment would be longer. Stop comparing, or if this helps, always have your own who you are in the back of your mind. What can you do with what can you have is much more important than what it should be done with something that some other people did. Try to eat healthy, try to do your sport, and try to increase the quality of your sleep. This is everything I advise my patients to focus on during treatment. And please know that this is the basis. After that, it's your doctors to help you, but this is your own piece. And I hope I've been specific enough. Thank you.